Through the Come Care With Me program, a partnership between Iowa Caregivers Association and PHI, Iowa's elected officials are learning firsthand how important direct care workers are to Iowans.
I think it's important that the Kellys of the world that I worked with today have their story told. But Kelly gets up and goes to work every day, and hardly anybody knows the value that she brings to the community. And being able to share those half hour, an hour today with her is very important. And I would wish this was everyday news, because Kelly is an everyday hero, and more people need to know about the value of her work. And we need to make sure that they are paid well, that they have benefits, so they can take care of their families too, just like they take care of the families here.
Turnover is a real significant problem, as it is in any business. It feels to us as if it's a fairly consistent turnover. It makes turmoil for our residents. Our residents, based on the fact that all of our residents here all have cognitive difficulties. One of the things you really need to do is keep things constant, to have the same faces, the same places, the same activities on an ongoing basis. And it's very stressful for them to see new faces all the time, to have different people all the time. It's sort of ironic that baseball players are making and football players are making what they're making, and healthcare workers are making $8 an hour. And these, as I put it, are the hearts and hands of what healthcare is all about, and yet we pay them the least. And it's just really, socially, it's unconscionable.
I was glad that I was able to share with someone like the senator because of the position that he has. And I was glad that he was able to pitch in and do hands-on, because when you're able to touch, use your hands to touch and you get more feedback, and it makes you to remember.
This line of work often comes with nicknames and that kind of thing. I mean, people think that all we do is toilet people, change people, clean them up, and that's it. And it's a lot more than that. I mean, we care about these people. We take care of them, and we care for them.
It also makes us feel really good. I mean, not to be selfish, but
right.
There's nothing like the feeling of knowing that you've helped make somebody's life a little easier, especially when they couldn't do it on their own. Or we do have some people that have no family at all, and that they're getting some love in years that they might not have gotten any at all otherwise. So it's a big deal.
If the CNAs were not here, I would be in a lot of trouble. They do things for me that I simply cannot do anymore. They're like family members.
It was important for me, as we family members came and went from the facility, to realize when we stepped out how well she was cared for.
It was been a great experience for me to come in and job shadow a couple of the direct care workers today.
They work hard, don't they?
They do, they do. And you can watch it on TV or you can read about it, but until you really actually do the work, you don't really understand all that's involved.
This is an occupation. They're paraprofessionals, and they need a good wage. They need benefits to go along with that, and we really feel that that's pretty important. They also need the recognition from not just the families and the residents. They get lots of that, or from myself. It's from the community.
When you're making $8 to $9 an hour, you're having to pay for insurance. Well, pretty much your paycheck is going to benefits. And sometimes those benefits aren't always the best. I think our aides, they're individuals, they're out in the field, they're working independently. They deserve to be paid more, and the average scale is, $7.50 to $8.50 starting, and that you just can't make a living on that. And they are the primary caregivers.
I would say affordable health care. We take care of sick people. We are definitely exposed to a lot of germs and things like that, and to not have health insurance for yourself can definitely be very scary.
My primary takeaway would be, I guess, how wonderful it is that we can keep these individuals in the home and that they have a home environment, and how important that is, I think, to Rachel, I mean, she gets to stay in a home and be a part of the family and go to family activities and go to school instead of being institutionalized. You know, I'm a mom and a grandma, and it was just really inspirational to see how she can, you know, be part of everyday life and really participate. And you could tell that she was excited to get on the bus and to start her day, and just so appreciative of a family that is there for her, and to make sure that she has all of that, all that normal activity that kids get to go through. It just was really neat to see her look down at me like I'm off for the day and ready to go, and I just thought that was pretty neat.
I just couldn't imagine our life without direct care workers. I think most certainly Rachel would probably be in have to live in an institution by now if we didn't have that support.
People need to recognize that doing this job is not as easy as they seem to think. Everyone thinks that somebody can walk in off the street and take care of somebody else. That's not true. You need to have the education, you need to have the experience, and right now there is a desperate need for those people. So if anyone has ever thought about doing this, please try it, help someone. Everyone needs someone.